I just finished the morning session of the KASS meeting, KASS, the Korean American Spine Society meeting, starting with talks by Howard Ahn, and I was sitting next to Casey Lee. They are the OGs that started KASS. They're also my mentors and role models, and this is one of my favorite meetings because it's a bunch of Koreans all here, and we bring our families and we go to everyone's talks and we listen. And one of my heroes is Dr. Rex Marco, a surgeon from Texas, and he unfortunately sustained a bad cervical spine injury mountain biking. He now studies spinal cord injury, and he gave us a great talk about what's going on in spinal cord injury today and the amount of progress that's been made. There is a new promise to help these patients that are quadriplegic and paraplegic get back to life again. Then there's Ernest Braxton, is a hotshot neurosurgeon in Vail. He used to be active duty Air Force, but he's specializing in awake spinal fusions. So he does these surgeries in patients that are awake the whole time, and they get to go home the same day. And a lot of things are advantageous for the patient when you do surgery awake. Finally, we heard some talks about how to avoid a fusion. So Chang, he's the active duty Navy neurosurgeon. He is starting to do endoscopic surgery. And one of the things that he does is endoscopic surgery to avoid a fusion, which goes very much in line with a talk by one of my favorite colleagues, Dr. Hun Bae from Cedars-Sinai. And he gave a great talk on patients that have multi-level disease that often get treated with a 3, 4, 5-level fusion. And he tries very hard to avoid multi-level fusions by creating hybrid constructs. Some levels that need to be fused are fused, but other levels get a disc replacement instead. And that way you avoid all the trouble with multi-level cervical fusion surgery, which makes the neck very, very stiff. And then of course, Dr. Andrew Chung gave a talk. He's from Phoenix, and he talked about using minimally invasive techniques to treat problems that would otherwise need a fusion. And the idea is simple. If you minimize the collateral damage to all the surrounding structures, then maybe you don't create so much instability that you need to do a fusion. So there's a lot of really exciting stuff going on, and the morning session was huge, but I'm going back in there to try to learn even more.